This is Channel 7 Ada Nightly News, and I'm Veronica Cornystone with tonight's top story. The ongoing murder investigation. 5 students, which is 25% of Ohio Northern's population, have succumbed to the deprived acts of the Ada Strangler. Police have now released the names of our 3 top suspects. Edward Collins, Jordan Strader, and Rodney P. Anderson. These 3 are highly dangerous. If you have any information regarding them, please call our hotline shown at the bottom of the screen, 1-800-867-5309. Now let's go to Nancy Drew at the scene of one of the crimes. Hey Nancy, tell us what has occurred.
Well, all the victims seem to have similar stories. All 5 went to Ohio Northern's health center complaining of a cough, fever, chest pain, and breathlessness. And however, all were told by the health center that it was just seasonal allergies and stress. We believe, since all of the victims went to the same clinic, that the killer might have been creeping and targeting the vulnerable individuals. All the victims were found in pools of blood, but no outside wounds were found. All of the bodies had been taken to be autopsied. Back to you, Veronica.
Thanks, Nancy. Now a quick word from our sponsor.
Hi, Billy Mays here. Want to know the best way to get blood out of your clothes? Well, America's serial killers recommend OxyClean. Whether it's the spots or the splatters, whether it's ground in, smeared on, or dried up, OxyClean gets out blood that detergents leave behind. Cleaner, whiter, brighter. Now that's OxyClean.
We have just received an urgent update about the Ada Strangler.
We just got the autopsy reports back, and it turns out that the killer is none other than a small outbreak of tuberculosis and not the Ada Strangler.
Tuberculosis? I thought that was eradicated in the 1800s.
Actually, it's still really prevalent and kills about 2 million people a year. The autopsy found that all the victims had shadows on their lungs, which are known as granulomas and are characteristic of tuberculosis. After this was found, an acid-fast staining test was done on the patient's sputum, and all were found to have acid-fast bacilli, which led to the diagnosis of tuberculosis. The diagnosis also explained the blood pools that were found at the scene of the crime, since a symptom of tuberculosis is the coughing up of bloody sputum. The bacteria that's responsible for these deaths may still be lingering in the air, so now we'll head to our consultant, Dr. Pepper, for tips on how to avoid further contamination.
Thanks. The bacteria that causes tuberculosis, Mycobacterium tuberculosis, can be easily transmitted through inhalation when an infected person either sneezes or coughs the respiratory droplets through the air. Due to its waxy outer coat, the bacteria stays in the air for many hours where a healthy person can inhale it. After inhalation, it travels to the lungs and attaches to the macrophages where it replicates. Even if you don't feel any symptoms, you should still get the tuberculin skin test done, just in case that you have the latent form of the disease. Trust me, I'm a doctor.
Good. Thank you, Dr. Pepper. Now let's go to President Baker's assistant to find out what actions the university is taking to treat and prevent this disease.
Hi, we are testing all students to determine whether they have latent or active tuberculosis. Those who test positive for latent tuberculosis are given a single antibiotic, but those who test positive for the active form are given multiple antibiotics to get rid of the infection. This treatment can last anywhere from 6 to 24 months. Those who test positive for the active form are also placed in isolation in the Clark building, where an exhaust system has been installed with high-efficiency particulate air filtration system.
Is there a vaccine the students can get if there is a tuberculosis outbreak?
Yes, but since tuberculosis is rare in the United States, the vaccine is rarely given to people.
Thank you. Well, that wraps up another nightly news. Stay classy, Ohio Northern.